Alright, well, good afternoon. My name is Billy Hernandez. I'm a paramedic with NAS Corpus Christi. I'm here to show you what is required as far as performing CPR on a cardiac arrest patient. And just imagine that you're walking into a grocery store and the person in front of you collapses, is not breathing, has no pulse, and nobody else is around you. What would you do? Well, I'm here to show you what to do in the event that you find yourself in this position. Now, CPR does involve ventilation and compression, but there are other factors that can help contribute to the success of this cardiac patient and whether or not greaten his survival, chances of survival. As a paramedic, I've been on numerous cardiac arrest emergencies, so I know what is required as far as CPR. So today you will learn how to recognize cardiac arrest patient, how to properly give compressions, and how to ventilate, and what is required whenever an AED is on the scene. All right. So with that, we'll go ahead. Unfortunately, this is not a this is just an introductory presentation, so no CPR classes will be issued. I'm sorry. All right, so we're going to go ahead and get started. Like I said, due to some of the things you're going to learn, recognize, call CPR, and the arrival of AED. So the first thing you'd like to do is you want to check for responsiveness. If the person falls out in front of you, you're going to go ahead and check them. You know, ask them questions. Hello, hello, sir, sir, ma'am, ma'am, you okay? See if they're able to come to. If not, you're going to want to go ahead and check their breathing. By checking their breathing, you can go ahead and kneel down wherever they're at. You want to place your ear over their mouth and nose so you can hear whether or not air is going in and out, while also looking down at their chest to see whether or not their chest is rising or falling. If you can't hear or see any of that, you're going to want to go ahead and check their pulse. And like this is showing you right here, you want to check their carotid pulse. You want to go on the side that's closest to you. You don't want to cross over their neck, because that could, if they do have an open airway, that could cause it to collapse or close it. So you want to go ahead and get your first two fingers and go ahead and check for carotid. All right. If that's not present, you're going to want to go ahead and call for 911. If it's just you alone and you witness it, call for 911 and then go ahead and start performing CPR. If you have somebody with you, have them call 911 or go get other help. Go get an AED while you start performing CPR. So now we're going to go ahead and move on to performing CPR. First thing you want to do is you want to start with the chest compressions, because there might be oxygenated air within the lungs. So with that, you can go ahead and start the compressions to kind of get the oxygenation circulating through the body. So you want to start with chest compressions. The placement of your hands, you're going to want to go to the center of the chest and just along where the nipple line is, in the middle. And whenever you start doing your compressions, you're going to want to lock your elbows and your shoulders, because if you start using your elbows and your shoulders, you're going to wear yourself out really fast. So you're going to want to lock your elbows and shoulders and pivot forward using your hips and your back to go down. So you're going to want to keep doing that. You're going to want to give them 30 compressions, and you want to allow the chest to recoil. And as far as depth, you're going to want to go 2 inches down, approximately 2 inches down. Now all of these is for an adult patients. When you get as far as pediatrics and infants, you're going to, the depths change. But we're not going to get into that right now, so this is strictly for adults. Alright, so now you got your chest compressions. You're going to want to go ahead and do ventilations. If you see that the patient fell, say he could possibly have a neck injury. So there are two ways to look at it. You can have suspected neck injuries or no neck injuries. So if it's a no neck injury, you could utilize the head tilt chin lift, where you just push down on the head and lift up on the chin to open up the airway on the throat. Like I said, if the patient fell from a wall off a building or something like that, he might have a neck injury, so you want to utilize the jaw thrust, in which you kind of straddle his head, and you place each of your hands on the other side of his head, and you push down on the jaw to open up the airway. All right. With that, now once you have the airway open, you're going to want to give 2 ventilations. If you have a pocket mask with you, utilize that. If you don't, then mouth to mouth to seal, you can still use that. So like I said, you're going to want to give 2 ventilations. You're going to allow full recoil of the chest. You're going to want to watch, as you're giving the breath, you can look down and watch the chest rise and the chest fall. Okay. So with that, you have your compressions, and you got your compression rate, and you have your ventilation rate. The ratio for that, you're going to want to get 30 compressions for every 2 breaths, and that is 1 cycle right there. So you're going to want to perform the cycle 5 times, and after the 5th cycle, you're going to want to check to see if he has a pulse, or he has responsiveness, or any change in the patient. If not, you're going to want to keep going until you have an arrival of an AED or advanced life support. Okay, so now that once you have the arrival of the AED, you're going to want to continue CPR while the person that brought the AED applies it. So you're going to attaches it. So you're going to want to place the pads. The AED has pictures that show you placement and everything like that of where you want to put everything. So you're going to want to place your pads on the chest and on the torso. And if the patient has hair or is sweating, you're going to want to wipe the sweat off, or you can use a sticky part of the pads to remove hair. Now, once you have the pads on, you're going to go ahead and connect the cable to the AED, and the AED will analyze to see whether or not there is a shockable rhythm. The AED will not shock unless the patient needs to be shocked. So there's no fear of you shocking him and having him go back into cardiac arrest. So once the AED has analyzed and it shows you that shock advised, then you will make sure everybody is clear of the patient, not touching the patient. You're clear, I'm clear, everybody clear, and then you're going to go ahead and shock. Once that's shocked, going to analyze, then it'll prompt you, it'll analyze, and then it'll prompt you to continue CPR. Now, once it prompts you, if it says no shock advised, I mean, there is a pulse, check for a pulse. If the AED tells you continue CPR, go ahead and continue CPR until advanced life support arrives. And once they arrive, they'll grab the patient and they'll do further things like medications and hook them up to their defibrillator and transport the patient. So I just showed you what it takes to properly recognize cardiac arrest, call for 911, how to quality give CPR, and what to do when the AED arrives. With these skills that I displayed to you guys, you will be able to properly give CPR and heighten the patient's, victim's chances of survival. Like I said, unfortunately this is not a CPR class, it's just introductory, so there will be no cards issues. But if you'd like to take part in class, just contact your American Heart Association in your area, and they'll tell you classes that are being given in the area. So,
Sweet.
thank you.
Thank you.